All right, well, why don't we call the meeting to order? Fairfield Board of Health, May 10th, at 7:33. In attendance, we have myself, Henry Yoon, Ms. Vitale, Dr. Morose, Dr. Mitchell. Ms. Steno is coming in and out, but hopefully she'll be able to hear us. And Ms. Sturgey is on the phone as well. We also have our Director of Health, Mr. Cleary, our Director of Nursing, Ms. Mitchell, and Ms. Flynn, who is also joining us here at the meeting. Is there anyone else that I missed? Okay, fantastic.
Mark Hotchkiss.
Did you get Mark?
Oh, sorry, Dr. Hotchkiss. Yes, I thought I did, but I apologize.
No worry. Yeah.
Don't think I'm not going to go back and replay this and see if I actually did catch it or not. So anyway, hopefully everyone has had a chance to take a look at the meeting minutes from the April 19th meeting. Does anyone have any questions, concerns, comments, edits, suggestions? If not, if I can get a motion to approve the minutes as presented.
Motion to approve.
All right, thank you, Dr. Hotchkiss, seconded by Ms. Vitale. All those in favor, please raise your hand or say aye. Thank you. Any opposed or abstentions? Great. Mayor Francis, you there?
Can't get anything.
Oh, Mayor Francis, we can hear you.
We can hear you.
All right, fantastic. Why don't we, hopefully she can hear. Why don't we move on to the Director of Health report? Sands?
Sure. So as of today, we are at 5,200 cases in Fairfield, 203 deaths. This is the first time in a number of weeks that we have, in a long time, that we're not in the state's red zone. This week, our number of cases dropped down to 12.1 per 100,000, which is a good sign. We've had a series of weeks with a downward trend in terms of that variable, and a good 5 weeks of downward trends with most of the other variables in terms of cases, hospitalizations. So we're moving in the right direction in that regard. We are, for example, the previous week, this most recent week, we had 36 cases. And then the previous week, we had 69 cases. So it's a good steep decline that we're seeing. Really in the state about April, in terms of, well, I jumped in here, put a variable. To talk about vaccine coverage. So we saw a peak of vaccination around April 10th in the state was really the peak. And we kind of saw it right around the same time for us in Fairfield. That April 10th we were at 312,000 vaccinations per week. Now we're dropped down to about 216,000 vaccinations per week in the state of Connecticut. In terms of how Connecticut's doing, Connecticut's has about 52% of the population, 52.24, have received at least one dose across all ages. And 39% are fully vaccinated. So we were, if I recall correctly, the governor posted most recently that Andrea, do you have the ability to, I don't know if anyone else gets it, a high pitch like squeak.
Oh, sorry. Could everyone please mute themselves if they're not speaking?
So Connecticut was the first state to go above 50% in the for all population receiving one dose. In Fairfield, we're doing a bit better than that. Yeah, and it just depends on how you look at the data. So the state is showing on their main vaccination webpage that we have 57% of all ages receiving the first dose. That's 16 and above. But then if you look at the breakdown for 65 and older, we're at 94% receiving one dose. For 45 to 64, we're at 83.25%. And 15 to 44, we're at 53.89%. So the interesting thing is if you average those across those whole age group, we get 76 point or 79, 77% receiving the first dose versus what the state is saying is 57%. And then I actually went, they have provide us access to some GIS data by census tract. And when I look at all the census tracts and do an average of that, we're at a little over 72% receiving first dose of vaccination. So we're somewhere between, this 57 that the state is saying and 76 that they're saying in another data set. So I haven't got to the chance to sort of look at if it's the same week over week comparison if one data set is a little older. So it's in some sense it's good news that our numbers, our coverage is higher than what's being experienced by the state overall and higher than in Fairfield County. It's interesting to see when the census tract map, when you get down to the census tract level, some of our census tracts actually show 100, which I can't, I'm surprised, but 100% vaccination of all 65 and olders in several census tracts. So it's interesting to see how they break it down. So right now we have administered 21,604 vaccinations. The health department has. Last 3 weeks since our last meeting, we've had 4 clinics that we've put on and a 5th one that we coordinated with Hartford Healthcare. It was held at Black Rock Church, and they vaccinated. It was, we asked them to get Pfizer so they could vaccinate 16 and 17-year-olds, and we were able to, through the call center, fill all 170 spots that they had with mostly, not all, but mostly younger folks. So in the last 3 weeks, we've been able to sort of coordinate or offer ourselves 5 clinics in town. The demand is really dying down for those who are, 16 and older. We're seeing in terms of some of the clinics in later May, I think the last 2 weeks of May, I think we have like 12 people coming for first doses. We have hundreds of second doses that we're offering, but it's very small and just a handful. Like, I think we have 2 people on the June 3rd clinic that we have scheduled for first doses. So the demand has really just sharply dropped off. And so we're considering, what's happening this week is, as many of you are aware, their FDA approved the Pfizer for 12 to 15-year-olds, and the ACIP will be voting Wednesday. The state has indicated if ACIP approves on Wednesday, we can start vaccinating that age group on Thursday. We did place an order last week with the state to receive the minimum shipment of Pfizer from the state, which is 1,170 doses, but in coordination with the state, we were able to arrange with St. Vincent's Hospital that they will receive it for us and store it in its frozen state, so it has it lasts longer than 7 days at refrigerator temperatures or the 2 weeks at standard freezer temperatures. Basically, we will open up a clinic once the approval goes through. We will most likely have a clinic as soon as Thursday. Potentially Thursday and Friday, we'll have Pfizer clinics for 12 to 15, and we will, due to sort of limited supply that we have and the unknown demand, we're just going to go with appointments only by VAMS through the VAMS system, and the state has changed the VAMS system to make it much more user friendly, so that people can actually go right to the state site, select a clinic, select a time, and get that set, and then go through the registration process with the VAMS system after they've found a clinic and a site, a date that they want. So makes the process a little bit easier for them to figure out. They don't have to wait. We don't have to wait a day for the state to upload them, that kind of thing. It goes directly into the VAMS system now. So we'll likely have that. It just depends on the approval process. So that's what we'll be working on. So that's sort of the COVID updates from the last 3 weeks. We did get the approval to fill our empty sanitarian A position, which is one of our environmental inspectors that retired with the early retirement offer with the reorganization that First Selectwoman Kupchik was doing. And so we have started interviews for that, and we'll have interviews, had interviews Friday, and we'll have additional interviews tomorrow. And so we're going to interview 6 candidates, good qualified candidates that we're getting, so that's good. We have had a lot of condemnation board activity past month with 2 citation appeal hearings. We issued 3 citation appeal hearings, or 2 hearings, 3 properties. We issued citations at several properties at the most recent meeting in late April, and then people have the right to appeal that. We have a hearing officer with the town. So we had 2 hearings for the 3 properties, and in all cases, our citations were upheld by the hearing officer, meaning that the properties move, the fines that are involved in the citation do move forward. And it's, we don't do it lightly. It's $100 a day fine. And so these people, 2 of the properties had started being fined, and 1 will be starting in another week. And so, but that's been busy for us and Andrea. We did get through the budget hearings. Our budget was approved with no additional cuts or changes to our individual budget on May 3rd. And then just we received notice from Regal Healthcare, Regal Care in South Florida, the nursing home there that is one of the ones that will be going on strike. So we were notified last week by the administrator there, and we had a meeting today with police, fire, and health department to review their plan, protocols that they're going to be following, and their security needs to, if the strike does happen, which is scheduled to happen this Friday at 6 a.m., so that the police are ready and all the systems are in place and the staff is in place so that they can provide the care they need, and that they can do it in a safe manner with the assistance of Fairfield Police. And that is really all I have, if anybody has any questions.
Great. Thank you. Does anyone have any questions for Mr. Cleary? Really? Okay. All right.
What's on at 8? I want to know what's on at 8.
I must be. Great. Jill?
Thank you. Well, just following up with what Sam said, the numbers in the school are following suit. Last week, for the week ending last Monday, we had 11 cases in the school. This week, we only have 4. And we had a couple of days with no cases, including today, which I just couldn't be happier about on many levels. I'm very pleased with that. As Sam says, going forward with the proposed, well, hopefully proposed clinics for the 12 to 16-year-olds, we hope to see even better results. I will say we've gotten a significant number of students in the high school, 16 and above, submitting their immunization records, which is really encouraging. And I just look forward to the other age groups now following suit. The other big news as far as school health is concerned is that Connecticut will no longer allow religious exemptions from childhood immunizations, immunization requirements at schools, colleges, or even daycare. This was signed into law by Governor Lamont on April 28th. And there's been some confusion in the rollout. We haven't received any legislative language that would really make things a little bit more clear cut for us. One thing that we know for sure is that all students who are currently in K through 12 and have a religious exemption on record as of April 28th, on or before April 28th, will be grandfathered for the rest of their academic career, K through 12. Seventh graders typically would have to renew their religious exemptions. That's no longer in place. Out-of-state religious exemptions will no longer be accepted, although other districts, students coming in from other districts, we will accept their religious exemptions. Medical exemptions are still acceptable, but I imagine that there'll be a little bit more increased scrutiny as we go forward with that. Part of our problem is that that they really haven't defined some of the language that they've put out there, like enrolled. We don't know if enrolled means registered or currently enrolled, or those enrolled for K right now, or pre-K right now. Will they have an exemption for a year or not? We do know that the K entry deadline, those students who are entering K fall of 21, they will need to be, their religious exemption will expire of fall of 2022. Now, whether or not that means that they should really, will we accept them being in process, or do we have to follow them this year while they're in pre-K to get those vaccinations in on time for their, we don't know. We haven't gotten, as I said, the definitive language from the state about that. So we shall see. The other thing is, I will say there was a huge flurry of people submitting religious exemptions prior to the 28th. I mean, it was very, very busy. And we just accepted them as you know, as the law stood at that time. And then once the governor signed the law, we were no longer allowed to accept them. So that's it. It was a confusing rollout, but hopefully it'll get clarified with more definitive language. The other thing I just wanted to mention is that although last week was Nurses Week, or last Wednesday was Nurses Wednesday, this Wednesday is School Nurses Day, National School Nurses Day. So we're doing a bit of a media blitz on Instagram and Facebook, and I invite you all to please take a look and give us lots of likes. And I really just want to say how proud I've been of the nurses and all the work they have done. I mean, they've done all of their regular nursing work this year, but they've also done all the contact tracing. They've maintained, you know, the front line with the teachers, of course, for the mitigation efforts in the schools. They've done so much counseling for all the quarantining students that we do, and I really rely on their help, you know, to make this work. And it just didn't start in September. Even last year when the nurses, when the schools closed, the nurses really helped out in a lot of different ways, from calling the seniors for wellness checks and coming in and doing the initial community contact tracing. And of course, I mean, the vaccine effort led up by SANS in the health department, but without the nurses, that would not have happened. So just stop by. If you know a school nurse, let her know you love her. That's it. Thanks.
Great. So, you know, let me be the first of many, you know, to recognize and acknowledge the phenomenal work that the school nurses have done, and the public health nurses in terms of, you know, everything that they're doing. You know, we acknowledge the school nurses every year, and rightfully so. I mean, they do a tremendous job, and I think if anything, you know, COVID has really pointed out how extraordinary they are in what they do, and the fact that I'm you know, I'm amazed that they were somehow able to squeeze the extra bandwidth out of what they were doing to sort of manage all these different things. But again, it just goes to show that our nurses have are truly in the profession that they're suited to be, to helping people and to step up when things are needed. And again, I'm sure I'll be one of many people to publicly acknowledge and with tremendous gratitude and appreciation for everything they do. So please share that with them when you have the opportunity.
I will, Henry. Thank you.
Does anyone else have any questions for Jill? Wow. Yes, Christine.
Jill, I had a question about the flu shot. Is that being required for all incoming kindergartners?
No,
Okay, I didn't think so, but thanks for,
it's only in pre-K.
okay. Thank you. And I echo, thank you, Dr. Yoon. He basically said, I think what everybody is feeling about our school nurses, you guys have been really the lifeline for the schools. We couldn't have done it without you. So thank you again. And we'll be more than happy to flood social media with thanks on Wednesday. So thank you for the reminder, and thank you for just this past Wednesday also for all nurses in the profession. Thank you.
Thanks.
All right. Sans, any communications?
I have none.
Yeah, neither do I. Anyone have any old business they'd like to discuss? Seeing none. Any new business?
I would just like to ask a couple questions just related to thoughts on still the disparity, I guess, between what the community is allowed to do and what the schools are allowed to do. I mean, one example I can come up with is, I know I bring up the music things all the time, but just that my kids who are musicians haven't been able to have a concert for the entire school year. Yet they have I have about 19 music gigs organized for my son's band between May and August in the private and public sector. So I would just love some commentary on that and how we're handling, in my opinion, kind of continued overly restrictive measures in the context of the school environment. It's kind of like adults can do this in this setting, but students aren't allowed to.
No, Sally, I appreciate that. That's a good question. However, we just had a request for I believe it was orchestra performance at Ludlow High School, and they presented it with meeting the sector guidelines for capacity in the big auditorium. It was for parents only. They said that they were going to be doing social distancing in the audience, and that the performers on stage, the students, they would be in socially distanced spaces. I guess it was the 6x9 boxes. That's what they were they were saying that they were going to do. So that was approved, actually. I just haven't seen any other requests come in.
Yeah, I think that's great to know. I think what I would love to happen, if it's possible, is just that maybe some communication comes out from the health department, almost encouraging basically some of the schools then to balance out those parameters to allow some of these things to occur. You know what I mean? And that it was approved in this certain context, because what I can foresee happening is some people at the 11th hour realizing, wait a minute, I didn't realize that we were allowed to do that. I know there's been a lot of discussion this year on fairness. Certainly when I was organizing the walkathon for middle school and fitting that into the parameters of the state guidelines. And, I can just think of a number of different things, like that Fairfield Woods had their middle school musical. Tomlinson didn't. Fairfield Woods had jazz band this year. Tomlinson didn't. there's actually a lot of, it seems like, kind of miscommunication, because it's almost like those department heads are being asked to be proactive, I guess, to create these. And I do think that there's some fear surrounding that. I know even for me in the role as the PTA, the co-president, there have been so many ideas that were a little bit squashed because, oh, that's not allowed, that there's almost been a fear of proposing things, you know?
Oh,
Like,
I hope there's not a fear. I mean, we'll take a look at every one of the proposals that come out, and I've been doing it all year long. I mean, when things were clearly
Yeah.
not allowed, and now with with what they've managed to come up with in terms of capacity in the auditorium, I mean, we'll certainly look
yeah,
at
I'll
anything.
give an example.
Sally, I actually don't know what the schedule is. I mean, what they do have planned. So
Yeah.
they have come to
Yeah.
me.
Another example maybe to touch upon, whether it's Christine or Sands and Jill, but the event form that needs to be filled out, for example, says no outside vendors.
Yeah.
So when I tried to get the steel drum, just a steel drum trio to play outside at the walkathon, I was told that's not allowed. However, last week we saw that outside vendors were at so many different places, because food trucks are outside vendors. So I think just some more clarification along those lines, because entertainment versus food, I mean, they're both vendors, just within slightly different.
Yeah, I didn't. That didn't come to my desk, so I can't comment on it.
Yeah, I mean, I know
But
we
then you see what
approved,
I mean? It's then what are we just like? Are people just slipping certain things through, and then there's the disparity there? I don't know if anybody wants to talk to that a little bit more. It's just been a bit of definitely a frustration for me, and I know many other parents in the district.
I would just say some of that can likely be attributed to just the changing scenario that we're facing currently with, the cases kind of coming down rapidly just recently,
Mhm.
and with the governor, I think with what happens after the 19th, which is we're still waiting to get clarification on when those many of the restrictions will go away, and to see what the legislature decides to leave in place. We're kind of all waiting to see what that is, and how that'll play out. The governor has indicated that you know some of the restrictions will stay in place for the school systems, will likely be recommended to continue. But again, I think we're evolving. I mean, just the planning team met recently and discussed proms with outside vendors coming in. So I think it's the positions are evolving, and it's was discussed. It was reviewed in terms of what the vendors would be doing and how they would function as a part of it. And so they were, those were approved to be there. I think Jill, if I recall correctly, the proms have some food truck vendors that are going to be on site.
No, not at the prom, Sands. No food, just water.
Oh, okay. I thought wasn't there talking about grab and go stuff at the end?
Um, just grab and go at the end. I mean,
Yeah, which I
just
think was
to, take home with you in the limo home, I guess.
yeah, I think that was from they were going to have a couple food trucks prepare that.
Yeah.
Yeah.
So I mean, I think the best I can say, Sally, is that I think that it's evolving each week, as we get further
Mhm.
away, as each week we see the rates continue to decline, we see vaccinations continue to go up, that and the posture from the state of Connecticut changing as well. And so I think after the 19th, I think there'll be a lot more that is able to
Like
be
permissible.
able to be approved. Yeah, I mean, because right
Mhm.
now there's a mishmash of restrictions and guidelines that are still, for us, essentially law. Seven AAA executive order currently on the homepage of the COVID site under guidance still says masks have to be worn inside and outside whenever you're going to be 6 feet from people. The sports guidance still says, that you should be wearing masks during practice, during active play, and on the sidelines. And so these are, while we can see that we feel the frustration of people wanting to move quickly away from some of these things, that they're still, for us, laws that we can't say, we can't publicly say, yeah, just go ahead and ignore them. We're not allowed to do that. And so those are the laws in place. After the 19th, they go away and there'll be a different landscape altogether. And we're all kind of waiting to see what that'll be. But
Okay, thank you very much. And happy Nurse Appreciation, by the way, Jill. We were doing that all week for home health care as well. And my mom was a school nurse for a while, so extra appreciative of that. Thank you.
Thank you.
The only I feel compelled to just sort of add just a comment along those lines. I think something that I have to constantly remind myself about when it comes down to sort of the different sets of rules that are being applied is I think we just need to remember that there are also competing priorities in different environments. So not to devalue music or vendors or things like that. I think again, I have to constantly remind myself that the priority is education for schools, right, and for students. And so not to suggest that music and art, and these things and the arts aren't part of the education, but I mean, I just remember early on, if you look at a perfect example is lunch, and you say, okay, well, lunchtime and students eating in the cafeteria, how is that different from them eating in restaurants? And in restaurants, they're a lot more lax, or they're not as stringent in terms of some of the requirements. Well, again, they're competing priorities. When you're out in a restaurant that's voluntary, that's different things. So I won't belabor the point, but I do have to remind myself regularly, and I would ask people to sort of keep that in mind as well. There are these competing priorities in different environments.
So I'm act and just say
Yep.
that music and arts education for many people is on the exact same priority as like the math and science and English. So I am going to make that point, and also make the point just that the sports, has been going on consistently in the high school. All of those different segments, they're able to perform technically and perform even with players from different districts. Just at Ward High School tonight was the Ward and Staples teams together, but again, the music departments haven't been able to perform. So I do think it's still analogous, but I made my point, and I know we're keeping this meeting succinct. So that's it from me for now.
Okay, thank you. Understood. Well taken. The other question I had was, Sans, do you have a sense of when we might be able to beat each other up in person?
Yeah, so the selectwoman and the head of IT, Dave Kelly, are working on a better methodology to enable public participation remotely, so that those who feel so that if we were to move to in person, that those who would like to participate but would like to do so remotely can participate, that they don't have to come in person. And so that's how it was explained to me, that they're working on this diligently right now to try and come up with. They realize that the WebEx approach that we've been trying, with some people calling in but not able to comment, and it just isn't. It's where we are now, but it's not necessarily, in line with and allowing true public participation. And so they're working on that, and as soon as that is worked out, then transitioning back to in person with a remote option.
All right, sort of hybrid meetings. Great. Well, that's good to hear. Glad someone's working on it.
I did want to add one critical statistic that, some of you may have seen, that when we went over 20,000 vaccinations, did the staff of the health department and the volunteers at the clinic did shoot a little dance video to celebrate that. We have over 8,000 views, I think it is now, on YouTube. So just It's a critical statistic that I thought I would close the meeting.
8,000?
Yeah, we're up over, I think.
It was
8,000
great. I
people.
saw it. I liked it. I thought it was great.
Oh, we were rocking it.
Thank you.
Yeah.
The health department can get monetized on YouTube, and then you can bring in a little extra income.
There you go. There you go.
Influencers.
All right, great. Any other business questions, concerns? Otherwise, if I can get a motion to adjourn. Oh, Ms. Vitale, thank you. Seconded by Ms. Connolly. All right, all those in favor? Thank
Aye.
you. All right, thanks, everyone.
Good night, everyone.
Good night.